Welcome, everyone, and thank you so much for joining the Georgia Recovers June webinar titled Creating LGBTQ Affirming Spaces in Addiction and Recovery. I'm your host, Jayla, and super excited to get into today's webinar. So for our agenda, we'll cover welcome and housekeeping, a brief overview about the Georgia Recovers campaign. I'll introduce our speaker who will then present, and then we will wrap up with a Q&A portion. So regarding housekeeping, this webinar will be recorded and a copy of the presentation will be available on the Georgia Recovers website. All attendees will be muted throughout the duration of the webinar. Please use the Q&A panel on the bottom of your screen to ask any questions. The chat is also available for general commentary, but won't be moderated as closely. So in the chat, feel free to say hello, let us know you're here, what organizations you're a part of. But for any questions, please use the Q&A panel. The interpreter will also be highlighted, spotlighted throughout the webinar. To adjust your view and see all of the speakers, click view in the top right corner of your screen and then select speaker or gallery. Users can also select a side-by-side view. Feel free to use the stream text link as well to access the live transcription of the webinar, which Ashley will share in the chat. Okay, and on to our Georgia Recovers overview. So Georgia Recovers is an evidence-based public health campaign that aims to reduce the prejudice and discrimination that is associated with substance use disorder in Georgia. The campaign is brought to you by DVHGD and builds off of the pivotal work of Georgia Council for Recovery. So we have a few goals and objectives, including increasing knowledge about substance use disorder and that recovery is not only possible, but probable. We want to improve attitudes towards those living with and or in recovery from substance use disorder and strengthen the capacity of stakeholders that are already responding to the crisis, including organizations like you all and individuals as well. So we have 3 pillars of work, including community connection, story sharing, and education. So under our community connection umbrella, we're able to connect with different community organizations across the state. We also have an advisory board, or what we call our community impact committee, which guide the direction of the campaign. Our story sharing efforts are the bread and butter of the Georgia Recovers campaign. So we collect stories of people that are in recovery and also their allies, loved ones, coworkers, family members, and we share these stories across our social media channels as well as our website. And then last but not least, our education pillar. So we seek to change attitudes by promoting positive messaging that speaks to hope and recovery. We also host these educational bi-monthly webinars to shed light on topics that are related to substance use disorder. So if you are interested in sharing your story with Georgia Recovers, please feel free to complete the story sharing interest form, which Ashley will share in the chat. I love to get connected and talk a little bit more about our story collection process. And also connect with us on our socials, on Instagram and Facebook, and join as an official community campaign partner. Ashley will also share that form in the chat. Takes about 5 seconds and we'll connect with you all from there. So on to our amazing speaker for today. So Frankie Berryman is the peer recovery mentor for outreach at Kennesaw State University Center for Adult Addiction and Recovery. He works with the alcohol and other drug education program to host events, workshops, and presentations across the university and acts as a liaison and peer mentor for students in and seeking recovery. Frankie sits on the Wellbeing at KSU Coalition and won the 2024 KSU Safe Space Award for his development of Queer Health, a speaker series that connects LGBTQ+ students to health and wellbeing resources on campus and in the community. Frankie believes in the power of recovery to transform lives and advocates for people of diverse backgrounds and lived experiences to access collegiate recovery and higher education. They find that the greatest gift of their recovery is the opportunity to be of service within their recovery network, and the greater community. They share that passion by coordinating volunteer opportunities with the Center for Young Adult Addiction and Recovery ambassador program, and hopes to inspire future students to pursue their passions while becoming advocates and allies for recovery. So everybody give Frankie a warm welcome. I'll go ahead and stop sharing my screen and pass it on to Frankie.
Awesome. Thank you so much, Jayla. I'll just share my screen now. Let's see. Right. Can everyone see the slide that I have up?
Looks good.
Awesome. Awesome. All right. So thank you, Jayla, so much for the introduction. As Jayla said, my name is Frankie Berryman. I am the peer recovery mentor for outreach at Kennesaw State University Center for Young Adult Addiction and Recovery. I use he, they pronouns, and I'm also a person in long-term recovery. My presentation kind of title today is Action Equals Life, Embracing LGBTQ plus people in recovery spaces. I've got a little tiny anecdote about why I titled it that in just a moment, but first we can get started. We're in a webinar, so we've got learning objectives. So today I'm going to go over understanding risk factors for substance use disorders in the LGBTQ plus community, identifying tools and techniques for creating recovery spaces inclusive of LGBTQ plus people, and understanding how to incorporate holistic health to better serve LGBTQ plus people in recovery. All right, so foundations. First of all, I called my presentation Action Equals Life, kind of as a reference to the advocates during the HIV/AIDS epidemic in the 80s. So that was part of a kind of campaign slogan that was very popular in that time. I'm very partial to it because to me, it very much represents a lot of what we do in recovery and a lot of other movements that recovery is founded on. And emphasizing that the actions that we take and the advocacy that we do can truly save lives and transform lives. So with that said, I wanted to take a moment to acknowledge that the recovery movement is built upon the foundations of the many different movements that came before it: disability rights movements, civil rights movements, other public health movements. And a lot of those have informed the practices that we have today during the recovery movement. And for me, because so much of the work that we do was originally envisioned by queer activists and pioneers, I think that it's our obligation as people working in recovery and in recovery spaces to work to reflect all of the people that need access to recovery and to really honor those foundations that our movement is built on. So that's kind of why this work is very close to my heart. But with that being said, I will do my best to give us a solid foundation to kind of build from today. But I can only speak from my own experiences. So I really encourage everyone to kind of make friends, invite new voices to the table, talk to people that are within like your very local community, and see what experiences they have that can help to inform the work that we do. Yeah. So I'll kind of get started with a little bit of background and research in order to understand a little bit about what LGBTQ people are up against when it comes to substance use disorder and mental health. We'll talk about a little bit of the statistics. This is by no means all encompassing. And I encourage everyone to kind of do your own research about the folks that are living in your areas and what their experiences have been. However, this can kind of help us to understand broadly what we're looking at when we're talking about LGBTQ plus people. So first of all, I know a lot of you are probably familiar with the National Survey on Drug Use and Health. It's something that a lot of us pull data from, and we're illustrating the importance of the work that we do in recovery. But something to kind of note about that is that the National Survey didn't start collecting sexual minority data until 2015 when it comes to substance use disorder and mental health. And they won't include gender identity data until the release of the 2023 data this fall. And the information that they'll include in the fall is sex assigned at birth and gender identity. So with that being said, we do have the transgender study that was released in 2015, which had a little bit more information on LGBTQ people's experiences with substance use disorder. And they'll also be releasing the early insights data, or they have already introduced the early insights data for 2022. So they have a 2015 survey and a 2022 survey. So with that being said, you can kind of see that there's a lot of gaps in our information and what we know about LGBTQ people in recovery and seeking recovery and experiencing substance use disorders. I've got some information on the screen that you can kind of read for yourself. I won't go into super detail about every single one. But broadly speaking, we do know that substance use disorders, eating disorders, and co-occurring mental health conditions such as anxiety and depression are more common in the LGBTQ plus community than other communities. However, kind of like I've talked about with the data and everything, your mileage may vary because research that really focuses on the LGBTQ community tends to be quite limited, not just due to the lack of data, as I talked about, but also due to like small sample sizes, researcher mistrust, for good reason. A lot of LGBTQ folks have had poor experiences with their information being collected. And then in just inconsistencies with how data is collected. We really want to have more data and research out there, but it's hard to have consistency due to it just being such a small pool of research that we have available at the moment. But yeah, so there's all of the kind of background and kind of a basis. I will kind of highlight really quickly just that transgender and gender nonconforming folks do also experience higher rates of eating disorder, co-occurrence, non-suicidal self-injury, and suicidality. Although some studies have indicated that transgender and cisgender adults may engage in drinking and other substance use at similar rates, which is kind of contrary to this bias that some people have out there that LGBTQ folks engage in risky substance use more often. But again, this can go back to a broad lack of information and data that's really difficult to confirm and verify. But there is some information out there that may show that we're kind of similar in those ways. Yeah, so there's kind of this big why, right? Why is substance use disorder sometimes prevalent in certain LGBT populations? I kind of wanted to start with this basis and kind of explicitly say, although I know a lot of us probably already know this kind of intuitively, but being LGBTQ plus in and of itself does not increase predisposition to addictive behaviors. I feel like it's kind of necessary to say that out loud and kind of dispel some of the myths and biases that might be out there. But yeah, so that kind of leaves why else? What are the reasons? So I'll kind of go over some of the ones on the screen, and some of these we'll get into a little bit more detail later as well. But I'll start with minority stress and multiple minority stress. Minority stress is basically just the excess stressors due to a person having an identity within a stigmatized minority group. This can be caused by poor social support, low socioeconomic status associated with it, and prejudice and discrimination, which you can see are also up here. And then multiple minority stress, which kind of is what it says on the tin. It's the compounding effect of having multiple minority identities. So that could be being a woman and being an LGBT person. That could be being disabled and being an LGBT person. Just the exponentially compounding factors of having multiple minority statuses. And then going right into that, prejudice and discrimination, stigmatization more broadly, but also stigmatization and discrimination that lead to barriers to diagnosis and treatment. Not just lack of specialized services, but lack of healthcare providers that know about LGBT plus folks and their special considerations for providing healthcare. And then abuse, trauma, bullying in school, societal abuse and bullying and trauma. These are all very common in the LGBTQ plus community and are factors for developing a substance use disorder. So a lot of folks might have seen something that looks a little bit like this, a model that looks similar to this in the past. I'm sure it's very familiar to y'all, even if it has looked a little bit different. This is basically a risk model for different factors of developing substance use disorder. And I wanted to use this kind of format that we're probably all pretty familiar with, or at least have seen before, to look at some of the special considerations that we just talked about and some additional factors for LGBT folks specifically. So since we already know that substance use disorder is not developed through poor choices, bad decisions, weak willpower, it's none of that. There are some other factors. So starting in the bottom right-hand corner, biology, we sometimes talk about and look at biological sex when talking about differences in risk factors for substance use disorder. But this can be a bit trickier with LGBTQ plus people and transgender and non-binary folks specifically. As someone myself who was assigned female at birth, the data or information might lump me in with cisgendered women. However, because I've been on hormone replacement therapy and taking testosterone, there are other changes and factors at work that can affect my biology, basically, in my body. And so this kind of also hand in hand goes with this lack of information, lack of healthcare providers with knowledge, right? The factors and considerations for my recovery and my healthcare would look different than other folks. And then kind of pulling out some things from environmental factors. Family attitudes and acceptance can be a huge factor. So if a person comes from a family who's accepting or not accepting of their identity, that can play a huge factor in developing substance use disorder. Community attitudes and peer influences. So historically, bars and nightclubs have been safe spaces for LGBTQ plus people to gather where they felt like they could find community. And of course, being in such a substance-rich environment can play another factor in a person's risk for developing substance use disorder. And then even more than that, in modern kind of settings, Smirnoff and other alcohol companies are some of the largest sponsors for Pride in Atlanta, Georgia. So that's right in our own state that alcohol companies and substances play such a huge factor in social communities for LGBTQ individuals. Yeah, so there's that kind of aspect of it as well. And then looking at substance specific factors. So age of first use is often younger for LGBT folks, especially if they come from families that are not accepting of their identities. They might use different substances as coping mechanisms for trauma or abuse or adverse childhood experiences, which goes right into this next kind of bubble in the top right. Trauma is a huge factor for LGBT individuals. And we know that multiple instances of trauma in a person's life can exponentially increase the likelihood of developing post-traumatic stress disorder, which is another co-occurring mental health condition for substance use disorder. So that's just kind of some of the factors and some of like the overviews. I want to kind of keep moving, but there are a lot of other things to consider and a total rabbit hole that you can fall down kind of looking at different risk factors. But yeah. So we'll continue on with the barriers for accessing recovery, accessing treatment, accessing supportive spaces for LGBT people. A lot of these look very similar to the previous slides because the same things that are risk factors for people developing a substance use disorder may also be barriers for folks accessing treatment for that substance use disorder. So where I've pulled this information from is kind of a couple of places. I've looked at some studies and some research, and then also the lived experiences of people that are in recovery, not just myself, but the folks that I work with who are LGBTQ and in or seeking recovery. So I'll kind of go over all of them and then jump into some detail about a couple of these ones. But we've got overt and indirect discrimination, limited intervention into discrimination and stigma within different spaces, lack of the LGBTQ plus presence in recovery spaces, and lack of LGBT specific recovery spaces, absence or fear of discussing LGBT plus topics. Gendered program structures can be especially difficult for trans and non-binary folks. Assumptions about sexuality, gender, race. That list is a little bit longer than what I can fit on there, but that would also include things like disability, things like that. Invasive personal questions, expectations of being educated on a person's identity, and identity concealment. So a couple of these that I want to specifically touch on that have been highlighted, not just in literature, but in lived experiences of folks as being especially difficult to overcome. Discrimination is a huge one. So that can include things like systemic discriminatory practices that can prevent a person from being able to enter a treatment facility due to their identity. That can also include social and interpersonal discrimination from not just healthcare providers, but also peers in the recovery community, peers in treatment facilities, things like that. Lack of LGBT presence is a big one. So personally, if I walk into a space and I don't see my own identity reflected in anyone that is there, anyone that's working there, anyone that is receiving treatment there, I might not feel safe and I might not feel that a person like me could access recovery in that space if there's no one else accessing that resource that looks like me. Assumptions about sexuality, gender. I include other intersectional things kind of in this one with an an LGBT identity, because again, the multiple minority stress is a big factor here. When people make assumptions about who we are just based on what we look like or what we say, that can be a huge barrier, right? So not just socially when we're talking about treatment and recovery, but also talking about like what actual mechanisms of recovery might be best for us, right? So a person might see us and assume like, oh, this resource would be the best for you. Whereas there's many things that we can't see about a person just by looking at them that can affect their access to that resource, their comfortability with that resource, the efficacy of a recovery resource for that specific person. So all of those things are special considerations that can prevent somebody from receiving the resources that they need. And then the last one that I kind of want to talk about is identity concealment. So this one is particularly kind of a consideration being in the South and accessing recovery. I'm very fortunate that I don't necessarily look like an LGBT person just by looking like at me. I am a trans person, and you can't necessarily tell just by looking at me. But sometimes, depending on recovery spaces, I might feel the need to not necessarily disclose that openly or talk about it as much because of who's in the room or because of what people say in a particular room or meeting or space. And this one has been kind of listed as a huge factor for a lot of folks. When we don't feel comfortable being our authentic selves in recovery spaces, it's really difficult to fully recover and embrace all that recovery has to offer. So that can be a huge barrier if folks feel like they have to be in the closet or hide their identity or be literally a different person just in order to access a resource. So that's kind of an overview of some of the barriers that folks have experienced more broadly and also with the folks that I've worked with. All right, so we'll get into some of the resources and options now. I know that was kind of a lot to go over on a broad scale, but one of my favorite things to talk about when working with LGBT folks in recovery or seeking recovery is a holistic health approach. And I'm sure that a lot of you have heard this and have perhaps like implemented a lot of things in your own practices and in your own recovery spaces. But I wanted to kind of intentionally bring some of this up for us to think about because I think it's very helpful for LGBT folks specifically. So LGBT people, in addition to struggling with substance use disorders, might have other co-occurring things going on, right, outside of their mental health, their substance use disorder. So LGBT people are at especially high risk for homelessness, poverty, abuse, just lots of different unfortunate circumstances just due to their identities. So it's important when they enter our recovery spaces that we're cognizant of that and that we make sure that the resources that we're offering to them are applicable to their life experiences, right? So some things that you might find when you have LGBTQ people seeking recovery resources is they might also be seeking medical resources. So this physical aspect, right? Like I mentioned, it can be hard to find LGBT affirming healthcare providers, not just for our recovery, but just for our health in general. And having folks having access to medical care that is adequate will be such a huge determinant in a person's success in recovery, right? If we can't get the medical care or go to the doctor, go to the dentist, get the treatment that we need, it can be really hard to focus on our recovery. And then in addition to that, having the medical insurance to access those doctors, even if they are affirming, which gets into that financial piece of it, right? Poverty is a huge issue with LGBTQ individuals and accessing financial stability. A couple of pieces that go into that would be job security. So having a job that is inclusive and open of a person's identities where they feel safe working in that environment and accessing that job to have financial security. And then also the home environment that a person comes from. Are the people that they're living with accepting of their identity? Do they have a home? All of these can be huge factors for a person who's seeking recovery that is also an LGBT person. And then a couple of other factors that I wanted to highlight. Accessing education can be difficult for people in recovery as well, and LGBT people in recovery. So this isn't just finishing high school, going to college, things like that. This is also additional like professional development, career development opportunities, accessing the education that we need to find those affirming and inclusive job opportunities, right? So all of those are factors that can influence a person's stability. And then the last one that's particularly near and dear to me because I'm a huge advocate for peer-to-peer and social recovery supports. what a person's social network looks like can be very influential on their ability to recover, right? So does a person have other LGBT friends? Do they have friends that accept their identity and love them for who they are? Do they have friends at all? Do they have a supportive social recovery network? So when they are coming to you, is it in your recovery organization, is this the first time that they have even met people that are in recovery, right? So all of those can be really important factors when considering what other aspects of a person's life they might need support with when they're finding recovery, right? And I hope you're starting to notice that a lot of this are not just factors for LGBT folks in recovery. These are kind of things that you could apply to anyone who walks into your space, right? They're just special considerations that we want to be particularly cognizant of when we're working with LGBT folks. All right, so action. There's a lot of things on this slide, but this is like my favorite thing. I'll try to kind of go over as much of this as I can, but I don't want this slide to be too intimidating because I know there's some things on here that might strike a particular chord or be particularly frustrating for folks when you're trying to implement some of these things into your spaces. So I encourage you to kind of take what works for you and understand that, like, I know we are in Georgia, we are in the South, and some of this is a little bit more difficult than other things on the list to implement in our spaces. And I'll try to be cognizant of that when I'm kind of going through some of these things. So number one, non-discrimination policies. Baseline, I encourage you to understand if your space that you're working in or recovery space that you're engaging in has non-discrimination policies. If they do, what do those look like? And how do they enforce those policies? Like we mentioned earlier, discrimination and stigma not being addressed in recovery spaces and in spaces in general can be a huge barrier for someone accessing treatment. In addition to that, what services and groups are you offering? Are there any that are specific for LGBTQ folks? Do you have mutual aid meetings? Do you have a peer support worker who specifically has experience working with LGBT folks? All of those can exponentially increase a person feeling comfortable accessing your services. Water break. Okay. So again, the next one might be a bit of a tough one. So talking about hiring LGBTQ plus people, volunteers, community partners, etc. I know that this is kind of a big one and it can kind of encompass a lot of different things when it comes to hiring practices. However, I know that whenever I walk into a space and I see my identity reflected in the folks that are working there and that are staffed there, I immediately feel so much more safe, so much more open to just be myself. So this kind of also expands, again, looking at just what your population looks like in your area that you're working with and seeing how you can reflect that in the folks that are working at your organization. Because inevitably they are people that are in your community that are working for you, right? So if we can create that diversity amongst our staff, it can help a lot of different folks feel safe to access recovery resources in our spaces. The next one is one that's pretty easy for a lot of folks to implement: intake forms and processes. Now, I know broadly intake forms is kind of a lot and paperwork is a lot, but what I'm talking about here specifically is just like the language on our forms. So something that we've implemented at my workplace is just kind of using a blank line where a lot of people use checkboxes. So when we're talking about gender identification or name, gender identification, a lot of folks might have like male, female, other, like tick boxes. One of the easiest ways that I create inclusivity in my space is just to use a blank line and let people self-identify and fill in. It can be a little bit more work on the back end if you're having to kind of keep some of that information and data and collect that, but it is a really, really small thing that can help folks feel included in your space. With names, I kind of want to touch on some forms that we have. If you do have paperwork that needs to be filled out to access certain resources, it might require a person to use their legal name, especially if you're helping somebody access government resources, for example, or financial assistance. Whenever possible, I like to make sure that I have somebody's preferred name noted and that is the name that I'm sharing with other staff members in my community. Because it's just a really small thing if somebody hasn't been able to legally change their name to something more affirming that you can do to make sure that you are adequately like seeing that person and reflecting that person. And then just having an option for them to note their pronouns, or for you to note their pronouns in your notes if you're working with them regularly, so that you can make sure that you're using the correct language to address that person. So the next thing on the list, considering how gendered programming impacts trans and non-binary folks. I know we talked about this a little bit before, but gendered programming can be a big barrier for folks who are outside of the gender binary, who are transgender. Even if they are able to access the resource, it might make things a little bit tricky. It might unintentionally out them if they're not comfortable talking about their identity, but your space only offers resources for men over here and women over here, for example. One small way that a lot of folks have addressed this is if you do have a meeting night or a community night, like that's a women's night, and then you have a men's night on a different night, for example, having a third night where just anyone in your community is welcome to come to that meeting and come out, and you intentionally kind of voice that in the way that you advertise that meeting or that night, can go a long way to making folks feel included. So where they feel like there is a space within your space that they can access, even if you do have gendered program that's specific for men and women. Staff training is another one. This one can be another difficult one because I know that a lot of folks already have a lot of training that they have to go through in order to work or volunteer with your organizations or in your recovery spaces. But just in the same way that we go through trainings to talk about different pathways to recovery and different ways that people recover and being inclusive and empathetic there, finding ways to include training to talk about diverse backgrounds, LGBT folks, other minority statuses, and how we can be empathetic and inclusive of those communities as well can go a long way to starting the education internally, right? Because if you've taken any kind of recovery ally training, you know that the very first step is kind of acknowledging your own experiences, where you're at, and how that impacts or biases you when you're interacting with the world. So just kind of taking that initial step to educate ourselves on how we're showing up and what our life experiences are and how those might be different from the peers that we're supporting. The next one, I love it. It's super easy. Visual cues of an affirming environment. So having your space be reflective of lots of different populations, lots of different folks is a super easy way to visually tell folks when they come into your recovery space that this is a place for them, regardless of how they're showing up. So I've got, I don't know if anyone has my screen on, but I've got a flag in here. And then I volunteer with our Pride organization on campus, and they gave me this little stuffed animal. So I keep these in our office just so that if there's any students that come in, they know visually immediately that I'm here for them and they can talk to me about that kind of stuff, right? And this can kind of go for a lot of things. If you went to a Juneteenth event this week and you got a flag or a poster or a sticker, and you want to make people aware that you support other populations that are different from your own experiences, popping those stickers or those flags up on your wall in your office or in your community organization. It's really small, but it is a start, and it is a way to kind of start changing the way that your space is inclusive of others, right? Okay, so next thing, bathroom access. I'm sure this has been a hot button topic all across the South for many years, but there's a couple of really easy things that we can do in this area to really make sure that folks feel included. And a lot of bathroom access conversation for LGBT folks does come from disabled rights advocates, right? So making sure that our bathrooms are accessible for folks in wheelchairs and for disabled folks. It's the same concept for LGBT folks, right? Making sure that if we have single stalled bathrooms, that we don't have men and women on two different bathrooms that are both single stalls. The great thing about changing it to just say bathroom is that now everyone has access to twice as many bathrooms in your space. So this is a great benefit, not just for LGBT folks, but for anyone who's accessing your space, right? It's just a small way that you can make sure that people feel comfortable coming into your space. And then, okay, moving on to language. This is kind of similar to the intake forms, paperwork, programming, just considering how you're using language and how you're talking to people in spaces. So the small things, right? So if we swapped out men and women for people when we're addressing large groups of folks, this is more inclusive, not just to trans and non-binary folks, but also we know that historically women have had less access to treatment and recovery spaces. So making sure that we're including them in our language and the way that we're speaking. So there's a lot of different ways that just those small changes can help clue people in to like, okay, this is a place where I can take a breath and just be myself, right? And then one of the most fun ones, celebrating identity, working to be a safe person for people to share personal information with. So moving beyond just like education and like strict like inclusion policies, practices, like administrative things, openly celebrating folks that come from different backgrounds is a great way to make sure that your space is more inclusive and more welcoming to other folks, right? So a small thing that you can do if somebody does feel safe coming out to you or talking to you about their identity, just celebrating that and taking a moment to thank them for sharing that information with you. And as you kind of work to educate yourself on different folks' experiences, this can be a great way to kind of reflect on what did you do in that moment to make that person feel safe, and how can you continue to carry that forward into future conversations, right? Doing a lot of that internal work and a lot of the kind of self-educating and self-work is a lot of what really makes people feel safe around us and makes them feel like we can openly kind of talk to them about those things, right? And then similarly to that, holding each other accountable. So if you work with other folks in your organization, you can all kind of work together towards some of these things. If there's a couple of things that you'd specifically like to implement to create a more inclusive environment in your recovery space, there is strength in numbers. So working together to hold each other accountable, right? So for example, if historically you've struggled with understanding pronouns and using pronouns that are different might be something new for you. Taking that extra effort to be like, hey, coworker, hey, friend, I noticed that we had a trans person come in and you're kind of struggling with the pronouns thing. Maybe we can practice together before this peer comes in next week so that we can both make sure that we're nailing it and getting it right. It's a great way to kind of take the heat off of our individual selves and make it feel a little bit less uncomfortable, right? Because acknowledging that we're like doing this new thing that we're not very good at by ourselves, that can be very uncomfortable, right? But if we're working together as an organization or as a group of friends or as a group of people in recovery to hold each other accountable, it can make the process a lot more accessible. And then lastly, on this kind of note, keeping it simple. So I hope that you've noticed that a lot of these things, again, are things that you can apply across different populations, and not just LGBTQ folks, but just anyone who comes into your space. We're all working towards the same goals. We all want to access recovery, not just for ourselves, but for people that are coming in and accessing our resources. And as long as we keep that in mind, it goes a long way to making this work that we're doing a lot easier. And then again, the keeping it simple part, like I said, some of this stuff might be just far beyond what we're able to do on an individual scale, but as long as we're kind of identifying what and why we can't necessarily do those things right now and keeping that in the back of our heads, it's a lot easier to advocate for change and advocate for our spaces to be more inclusive in the future when we get into rooms where we could make those changes, if we've done that work ahead of time and we've considered kind of what those barriers are for folks in recovery that are LGBTQ. So I've got one last kind of topic that I want to hit on, and that's kind of this resource gathering piece. So this slide that I have here, you can feel free to like screenshot or anything, but this is just a list of community resources that I provide during Queer Health for my students that are in or seeking recovery in our community. You'll notice that there are recovery resources that are LGBTQ inclusive. So Inclusive Recovery Athens, Galano Club, which is a 12-step meeting clubhouse in Atlanta. But there's also social organizations. So Southern Fried Queer Pride, who's not a recovery organization, but they are an LGBTQ safe space organization that hosts yoga, potlucks, movie nights, lots of different social events that are not focused around substance use. Cheris Books, which is one of the oldest feminist bookstores in Georgia and the Southeast, they host lots and lots of LGBT affirming events that are not centered around substance use. And they also have Trans and Friends adult and youth groups that you can access virtually. While they're not necessarily recovery meetings, they are kind of like mutual support meetings for trans folks. So this can be a great way to help support LGBT folks in your community, broadening kind of their social networks and their recovery capital. There's also a lot of other different resources on here. I won't touch on every single one, but I will point out that there is a non-alcoholic bar in Atlanta that I have on here because a lot of folks who are just curious about reducing their drinking or stopping drinking, they might still want to have that safe space that they're familiar with if they usually go to bars or clubs to meet up with their LGBT friends. This could be a great transitional way for them to kind of try out not drinking. So these are just some resources. And then I've got this slide here where we can talk about how we as individuals and community organizations can find resources like this within our own local communities, because I find that a lot of the work that I end up doing and that a lot of us end up doing when trying to do resource gathering within like recovery spaces, it is very like hyper local, right? Because a lot of LGBT folks and people more broadly in recovery can't necessarily drive across the state just to access something that's affirming or inclusive, right? So here are some things that we can look for within our own areas and some resources that it might be good to have in your back pocket. And it goes a lot into the holistic healthcare kind of thing that we talked about, right? So finding housing support, financial support, and food pantries broadly, but also that might be safe for LGBT folks to access. If you have an LGBT friend or community member who's accessed a resource like that before and had a good experience, noting that down so that you can refer other folks to it. LGBT inclusive workplaces that are hiring, that's a great one, especially if you have a lot of folks that are entering recovery and trying to restabilize and find access to work and financial stability. Making sure that you know which places are inclusive and accepting of LGBT folks is a great way to go. And then in that vein, low-cost opportunities for education or professional and career development so that you can help support them along their journey to stability if they're not ready to find a job yet and they just need to get some of that development and experience so that they can access hiring and jobs. Recovery and LGBT inclusive social spaces. So that's a lot of what I was talking about with Cheris Books and Southern Fried Queer Pride and some of these LGBT recovery community organizations. Not all of the resources that we offer have to be specifically like billed as recovery resources, right? We're just trying to find community spaces for people to exist. They might be scared that they're having to change their entire friend group or that they might not be able to have as much fun as a person in recovery, which is something that I'm sure a lot of folks have experienced. But for LGBT folks, it can be important to make sure that you're identifying social spaces that are safe for them to engage in and that make them feel affirmed. And then the last thing on the kind of list that I mentioned is the LGBTQ plus affirming doctors, right? So especially when we're in early substance use disorder recovery, finding folks who understand and like baseline affirm and acknowledge our identities when we're accessing recovery resources and healthcare resources can be really important, because poor experiences and traumatic experiences and discriminatory experiences are all things that can lead folks to choose not to enter recovery or to be hesitant about entering recovery. And I know it can be kind of a lot to try to figure out, okay, well, how do I know if these resources are the right resources to be offering my community? So the questions that I have on the right are kind of some ways that I kind of evaluate resources when I'm looking for specific things, right? So number one, is it current and up to date? You would not believe the number of resource lists that I have been sent for LGBT folks in recovery in Georgia, accessing medical care, accessing gender affirming care, that half the links are broken. Half of the resources are from 2002. Some of the organizations don't exist anymore because it's just that outdated of a list. So just doing that due diligence of quickly like clicking the links, checking, making sure that they are still up to date and relevant for your community. Is the information easy to find? How long did you have to spend finding this resource for the person that you are getting this resource for? If it took you like 3 business days, contacting 4 people, waiting on hold, we have very good evidence to suggest that all of those things would be huge barriers to a person actually utilizing the resources that you sent them. So anything that we can do ahead of time to help kind of speed up that process, especially if it's a good resource and it just takes a while to find or access the resource. So whether that's making a phone call and getting yourself a connection so that you can do that like warm handoff to the resource, anything that you can do to kind of shorten that process. And then, is it a safe resource for LGBTQ plus people? When you called and you were accessing the resource, when you were interacting with the folks, if you were able to go in person and you were interacting with the folks from that resource, How was their language? How was their demeanor? Did they appear to be an accepting and affirming group of people? It's a really baseline thing, but we just want to make sure that anywhere that we're sending our community members to access resources and to access recovery spaces, that they feel safe, baseline. And then does the resource have a cost associated with it? So this is a big one. So like if you find a gender affirming doctor or an LGBT affirming healthcare provider to help support your folks in early substance use disorder recovery, oftentimes LGBT affirming healthcare is more expensive. So just kind of having that in mind that a lot of LGBT folks don't have the resources to access all of those things, right? So just kind of doing our due diligence, making sure. Something that I love to know, if I have heard of community members around me going to treatment and accessing treatment, I'll note what their experience was there financial aid available, and did they accept insurance? And if so, what insurances were they accepting for that resource, right? And then hopefully sometimes there's a lot of resources that are free in your community, and hopefully you have recovery community organizations around you, or you work at a recovery community organization that already doesn't have a cost associated with it, which is great. And then kind of the last thing that I want to note here is that I really try not to refer people in recovery to services that I can't verify. I know that it's not always feasible to physically go to a resource, especially if you're not a person that would normally be accessing that resource, right? If you're not LGBT and you're trying to find LGBT doctors, that might not be a doctor that you would use, but finding ways to verify these resources so that we're making sure that they're safe, that they're up to date, and that they're just places that LGBT folks would want to be when they're accessing those resources. It can go a long way, and it can really show, even if a person doesn't end up using the resources that you're referring them to and that you're providing them with in your community, it does go a long way to just show that you took the care and the time to understand how their experiences might differ from yours when accessing those resources. And it can help to strengthen the relationship and make that person feel very safe coming to you for support with their recovery. I know that was a lot, but that is the kind of end of my presentation. And if anyone has any questions, comments, anything that they'd like to bring up, that's all I've got planned.
Thank you so much, Frankie. Really appreciate all the information that you were able to share. I even got a chance to like take some notes and highlight some of like my favorite action items that I could easily implement. So moving on to our questions, talk to us a little bit more about the role that community support plays in the recovery journey of LGBTQ folks, individuals, etc.
I love that question. Thank you, Jayla. So first of all, LGBT folks historically, like we are very community oriented folks. We're very social folks. A lot of the historical discrimination that LGBT folks have experienced has led us to be very supportive, community oriented, basically. So that definitely translates into recovery spaces. And it can be very important to make sure that LGBT folks feel like they're not losing that community support just because they're choosing to either reduce their substance use, stop using substances, especially if a lot of their social network does currently use substances or aren't necessarily supportive of abstinence or anything like that. Being cognizant of that is especially important when getting folks plugged into recovery resources, because if we feel like we're going it alone, it makes it 10 times harder. And then something that I've kind of tried to keep in mind, I've seen studies that have shown that even one supportive adult in a LGBT person's life as a child can dramatically reduce the risk of suicide or non-suicidal self-injury. And I definitely believe that that translates to us as adults and to us in our substance use recovery journeys, right? So even just having one person in our community who reflects that back to us and affirms us and validates us can be a huge factor in our motivation to continue accessing recovery supports and things like that.
Thank you so much. That's really helpful. Can you speak to the specific cultural considerations that should be taken into account when providing addiction treatment for LGBTQ plus individuals?
Yeah, absolutely. So I know that I talked a lot today about how a lot of the things that we're considering when we're looking at treating LGBT folks in recovery, they end up being very cross-translational across pretty much anyone that might be seeking recovery, which is great news for any of us who are new to working with LGBT folks, right? It just opens the doors a lot to being able to support LGBT folks. But basically, I would say some of like the number one things is just kind of going into it with openness and understanding that if you're not an LGBT person, it might take a little bit for you to kind of pick up on some of the way that a person speaks about their recovery or their substance use journey, and how they'd like to be addressed. So again, the gender identity and the pronouns and using the correct name, those small things from the beginning can very much influence a person's comfortability with accessing treatment. And then even outside of that, I think just having the openness and humility to question what you know about best practices in recovery, right? So I know a lot of people already do the work of kind of letting a person decide what's right for them in recovery. And that especially goes for LGBT folks. So looking at kind of these co-occurring things of like poverty and homelessness and other like financial instability that might go along with somebody's substance use, and not questioning if they say that something might not be right for them, kind of taking that for what it is and trying to understand for yourself, okay, what else can I offer this person that might be more supportive in this moment? And I hope that that kind of resonates with a lot of different populations, because it really is the same as a lot of other different work that we do, right?
Yeah, no, that's really helpful. I always think about, the power in the room, and you want to make sure that the person that you're assisting, that they keep this power for themselves. And that's what you're really speaking to as far as that trusting. And if someone says that, hey, this is best or not best for me, then, allowing them to own that, and you respect that. So how can we address intersectional issues such as race, socioeconomic status, ability within LGBTQ plus affirming recovery spaces?
Yeah, thank you for that. I think that really speaks to a lot of kind of what we've been talking about with the holistic healthcare kind of model, and multiple minority stressors, right? So like trauma, I think, is a big one, and it's number one. I feel like I always have trauma at the forefront of my mind when I'm thinking about intersectional identities and recovery. Because a lot of the time, what that means is that folks have experienced trauma from a lot of different directions that might be vastly different from what I've experienced. So doing a lot of like continuing education, I guess is what I would call it, for understanding how trauma can show up differently for different racial minorities, ethnic minorities within the LGBTQ population, differently between men and women even, and non-binary folks. I think that really goes a long way, because it helps to mitigate some of these like assumptions that we might make. Because one thing that I might do to support like a trauma response that I might have in myself, that might actually harm somebody else that I'm working with. So kind of taking cues from different identities to understand how trauma shows up generationally within that identity, and within the person. And I think that can go a long way to helping support intersectional folks. And then I think something that I hear a lot in different kind of ways is like, if you've met one LGBT person, you've met one LGBT person, right? Or like, if you've met one person in recovery, you've met one person in recovery. And so having that like humility of, okay, I might have these biases or these unintentional kind of stereotypes of what a woman in recovery might look like, or what a queer disabled person in recovery might look like, or what they might need. And kind of working to unlearn those biases and not being afraid to be wrong, right? Like, it is very uncomfortable to think about how I might not understand certain experiences in recovery because I'm a white person in recovery, right? And so just kind of not being afraid to kind of sit with that and ask questions and educate yourself in the appropriate spaces before you get into a space where someone is trying to receive resources from you, and all of a sudden you're unintentionally expecting them to educate you, right?
Yeah, thank you so much. And in the spirit of, not being afraid to be wrong and really sitting in that, we have a question from one of our participants, but really speaking to, having loved ones that are transgender and misgendering them in conversation, right? How do we ensure that our language is reflective? But also, hey, if I slip up or whatever the case may be, how do I ensure that I'm still being respectful and that I can ask for forgiveness and still invest in this relationship in a healthy way?
Yeah, thank you for that. I think that's a really great question. I think a lot of folks have experience with this, especially if you have met a person who is trans or non-binary for the first time. First of all, I definitely think even just wanting to get it right is a huge thing, and just wanting to show up for that person. Something that I've noticed that is the most kind of helpful way to go about it practically, I think, interacting with a lot of my peers that are trans in recovery, whenever you get them wrong, not being afraid to be like, hey, I'm so sorry, I messed that up, say the right pronoun, and then keep it moving. So kind of like for me, I think best practices most of the time would be correct yourself, apologize, keep it moving. Because that kind of shows that you're not harping on it, you're not trying to overemphasize. And honestly, in a lot of situations, it can unintentionally end up being like a situation where they end up feeling like they need to apologize to you or say, like, no, it's okay. It's okay. But just kind of owning it and keeping it moving. And then if you do have specific questions about your friend or family member and how they'd like to best be addressed, kind of taking a moment outside of that conversation where maybe you had a slip up and saying, hey, I noticed that I mess up with like your pronouns a lot, for example. Is there anything that you've noticed that you like better when I do it this way versus this way? So just kind of not being afraid to ask some questions, because a lot of trans folks, it'll be different for each person, right? And especially if you've known that person for a while, they might be kind of exploring this new level in your relationship as well, in a similar manner. Because at the end of the day, they're also changing their pronouns, right? So kind of viewing it as an opportunity for deepening your relationship with them and coming at it from that loving perspective. It's hard to get it wrong when you're not afraid to own up when you get it wrong and you are just approaching it lovingly, you know?
Yeah, thank you so much, Frankie. And last but not least, what strategies can be implemented to overcome barriers to accessing treatment for LGBTQ plus individuals in rural areas specifically?
Yeah, okay, I love this because I know in Georgia we've got a lot of like very populated areas and then very rural areas. And a lot of things are very much divided along those lines: access to treatment, access to recovery spaces in general, access, I mean, even food deserts in Georgia are a massive thing, right? So I think just kind of, like I said earlier, uh, resource gathering is a very hyper local thing, right? And that can be very tough for rural spaces if you do a survey of the area directly around where you're providing recovery support and it's just kind of empty. One great thing that I've noticed with like post COVID is the virtual spaces have just absolutely blossomed for LGBT folks in recovery. I know that one barrier with that is that you have to have access to the internet in order to do that. So considering if you are part of a recovery community organization in a rural area, how you can get folks access to get online and get plugged in can be a huge thing for the LGBT community specifically. I've noticed that NEDA, the National Eating Disorders Association, has LGBT meetups and groups online. There's lots of recovery meetings online. Like I mentioned, most of the recovery meetings and clubhouses that I had on my community resource list also had virtual resources. And then I noticed that there's a lot of outpatient treatment that happens virtually as well these days, and that can help to increase access to LGBT affirming treatment for folks in more rural areas, especially because typically, not always, virtual costs for healthcare is a little bit lower than attending something in person. I'll say I know it's not a perfect solution, and I know there's probably 1,000 other solutions depending on where you are and what your specific needs are. But that's what I found to be the most helpful for the folks in my area. For example, like being near a big university and working for a big university, while they're here, they have lots of resources. But if they go back home to their rural kind of communities in Georgia or in surrounding states, keeping them plugged in virtually has been the best way that I've seen to keep them coming back in the following semesters when they get back to campus and still interested in recovery.
Yeah, no, all of this information has been very, very helpful. And I feel comfortable with speaking on behalf of all of our participants, but hope that everyone stays in touch with you, Frankie, and we will do the exact same. Thanks everyone for joining the June Georgia Recovers webinar. And we will see you all soon. Thank you.
Thanks, Jayla.